Hello, this is Dr. Karmen Smith. I'm a spiritual teacher, author of the book, The I Am Solution, and I'm also a mental health therapist. And I'd like to share with you some insights about depression. I work for a company called Talkspace, and that is an online counseling service that anyone can join. And you're hooked up with a counselor. And so you can text as much as you'd like and participate in mental health services wherever you are on your phone. And so this is a key service that is really great to have right now because there are a lot of people suffering with depression and anxiety. I've done a couple of videos about depression and anxiety, and today I'd like to focus on depression and to give you some insight into some little known facts about depression. Did you know that depression also has to do with inflammation in the body? So they found through research that people that suffer from inflammation, in other words, people that are not healthy, that are not their best self physically, also suffer from depression. And they found that there is a link between inflammation in the body and feelings of hopelessness and feelings of suicide. Now, I'm also going to put the suicide helpline phone number linked to this video so that you never have to feel helpless or that you're at the end of your rope. There's always someone there to help. But I do want to emphasize that if you have suffered from a stroke, even arthritis, significant swelling of your joints that cause pain, did you know that this could also contribute to your feelings of depression? And so when you're going to your doctor and you're talking about the pain, also let them know that you're having some hopeless thoughts, that you also have felt like you're in a slump, that your moods are lower, that you feel empty inside. All of these are symptoms of depression. And so sometimes we do not diagnose it. Sometimes we misdiagnose it and we don't take into account the physical things that are going on when somebody comes to a counselor. So when you're going to a counselor, they're going to do a workup. They're going to give you a questionnaire. They're going to hopefully write out a report based on everything that you're presenting. And so they're going to ask you questions about your health and about if you've had a stroke, if you've had any accidents or anything like that affected your body that could have caused inflammation. Here's another little known secret, that negative thoughts, if you continue to have negative thoughts, did you know that can create inflammation in your brain and in your body? So the thoughts that we have affect our body, which affects the thoughts that we have and the mood that we have. It's kind of like a circle. And so we need to keep in mind that our thoughts are powerful. We need to always change our perception if we know that it's not doing us or serving us well. So you always want to be cognizant of how you are perceiving the world. And if you are perceiving the world in a negative way, it's going to have an effect on your body, which has an effect on your mood, which has an effect on how you see the world. And so even though it is a circle, there is treatment. And if you are doing counseling and you're talking about these feelings and changing your perception, you are involved in treatment. If you are taking a medication to reduce the swelling and talking about some of the things that you are feeling and thinking, then that is best practice, is to maybe a combination of both. So I hope this makes mental health a little bit more simple. It's not complicated. It's about loving yourself, taking care of yourself, and understanding with compassion those people that are suffering with it. Love you.